Everyone, I'm Jessica Denson, Director of Communications for Connected Nation. Our focus as a national nonprofit is to identify innovative solutions to expand access, adoption, and use of high-speed internet and its related technologies to all people. Advances in telehealth are a huge part of that work, as you can imagine, especially right now. This is our fourth webinar in a series of 5 that's focused specifically on the past, current, and emerging use of telemedicine. These discussions come on the heels of a telehealth study released by our state program, Connected Nation, Michigan. That study looked at the challenges and opportunities in telemedicine within rural counties. It was released just a week or 2 before the pandemic closures began happening. You can imagine telehealth programs began ramping up at a rapid rate as we were all asked to practice social distancing. Today, we're talking with Ryan Palmer, who is with the Federal Communications Commission. He currently serves as the chief of the Telecommunications Access Policy Division within the Wireline Competition Bureau. Ryan, thank you for joining us today to talk telehealth programs and decisions taking place at the federal level. These decisions will ultimately impact patients and healthcare providers, and so we really appreciate you being here with us today.
Well, thank you so much for having me. It's great to be here, and like I was saying to you before, I had a little time to look around on your website and research your organization. It seems like you're doing a lot of wonderful things, so we really appreciate that. It takes everyone from all levels, from the federal all the way down to local, if we really want to make this happen. So it's great to see what's happening in Michigan. Thanks for having me.
We do want to encourage everybody to send in their questions. Ryan is an expert in this field, and he is just dealing with people who are decision makers. He is one of those decision makers. So this is very important that we hear from you and what you want to know. So I do have some questions and information prepared for this webinar, but I'd like to encourage everybody to send us your questions. Before we get things underway, though, I'd like to share a little background about you, Ryan, and the division you now lead with the FCC. That way people have an understanding of your role and the division's role. So if I may, just everybody bear with me for one more moment. Ryan is the chief of the Telecommunications Access Policy Division within the Wireline Competition Bureau of the FCC. He took on that role in September of 2014. Prior to coming to the FCC, Ryan served as the commissioner of the West Virginia Public Service Commission from 2010 to 2014, during which time he was an active member of the National Association of Regulatory Utility Commissioners Committee on Telecommunications, as well as the Presidential Task Force on Federalism and Telecommunications. That's for the same group. From 2008 to 2010, Ryan served as the Deputy General Counsel for the Governor of West Virginia, and he was employed as an attorney aide for Commissioner Charlotte Lane at the United States International Trade Commission from 2003 to 2008. In addition, Ryan is a graduate of the he's a graduate of the West Virginia University College of Law. So you've got quite a pedigree. So now let's take it to the division that he is now leading, the Telecommunications Access Policy Division. It has a primary mission to advance the goals of universal service. And what that means is all Americans should have access to robust, affordable broadband, i.e. high-speed internet, and voice services. Consistent with that mission, the division is responsible for developing policies for administration and oversight of the Federal Universal Service Fund, which is comprised of programs designed to ensure access to affordable communications for schools, libraries, rural and low-income consumers, and healthcare providers, which is pertinent to our conversation today. In short, the Telecommunications Access Policy Division has principal oversight responsibility for all aspects of universal service policy issues, including the COVID-19 Telehealth Program. So that's a good place to get started, looking at how the FCC has responded to the pandemic and set a need for expanded telehealth services. Ryan, let's now throw it over to you. And there's been $200 million from Congress that has come out recently recognizing this need, the CARES Act, broadband, that deals with broadband connections and devices. Talk a little bit about this influx of money from Congress and why it's so key right now.
Well, thank you. And thanks for the introduction. I really so I want to get right into it. So you're right. This was a one-of-a-kind project that came along in the CARES Act, where the FCC received $200 million, and Congress made it clear they wanted us to get these funds out quickly to provide healthcare providers funding for telecommunications services, information services, and devices, which was a key component of this, to provide telehealth services in response to COVID-19. So that president signed this into law on the 27th of March, and by April 2nd, the commissioners had executed and adopted an order that set up this program and put the wheels in motion to make this happen in really record time. And then from April 13th, so just from the 27th when the president signed it, the 2nd the commissioners did the order, on the 13th we were accepting applications, and we accepted them through June 25th. They were considered on a rolling basis, and we prioritized applications in areas that were hardest hit by COVID-19 and where funding would have the most impact. So the commission received thousands of applications, and demand greatly exceeded the $200 million. So on July 8th, all approved funds were exhausted. And all told, we granted or awarded funding to 539 applications from healthcare providers that were located in 47 states, including or also Washington, D.C. and Guam. And it was a monumental effort across all bureaus and offices throughout the commission. Everyone was impacted and everyone contributed, because this is something that we didn't plan for pre-pandemic. So we were not only doing this on the fly, but we were doing it on the fly while we were all learning how to telework, or, doing this for the first time in this scale. And it just shows that, so many dedicated people at the commission worked around the clock to make this happen. And it was a privilege to really have an impact.
Now, just a quick question before we move forward a little bit with some of these items that you funded. Congress doesn't usually fund devices, but there was some of that in this round of funding. Is that correct? And why do you think there was a different approach?
That's correct. I think so. Traditionally, or in our programs, our universal service fund programs do not fund devices, whether we're talking about rural healthcare or we're talking about Lifeline or E-rate. And so this was a change. And I think what it was, once again, I should say, when I'm getting outside of the facts here, I'm speaking for myself and not the commissioners at the FCC or anyone else. But what I believe is they listened. Congress listened to what the needs were from these healthcare providers, and it wasn't just we need more money for broadband or new, platforms to make this happen. We also need to be able to provide devices to patients who don't have them, or also to have devices in our own facility that we can use differently than the ones we have now, whether it's telemedicine carts or other things. So it seems to me like Congress listened, and that they made it very clear that devices were an important part of this. And what we saw in reviewing applications were that there was a need for that. And so it was a good change from what we normally do.
Making those kind of decisions in just 3 months, talk a little bit about how difficult that was for your staff and you, especially now that you're suddenly finding yourself teleworking as well. Give us an understanding of, knowing that so many people needed help right now, what was on the line during that time, those 3 months, how important it was to move things quickly for you and your staff.
Yeah, we just, we feel all of our programs, and especially in USF, we're privileged to work on things that have a positive impact on our country, but they're more the normal long-term process. And for this to have such an immediate impact, where we know if we can get this done, hospital beds will be freed up, so because people can go home, we can treat more people. We can not only in the facility as needed, but also at home, and really have an impact on rural communities and hardest hit communities across the country. And it was, so everybody just said, let's get this done, and found a way to pull resources where needed. Because if you notice, the commission hasn't stopped its other work either. We've just been getting a ton accomplished, and probably even more productive during the last 6 months than at any other time. And so it was everybody just pitched in and worked really hard, but it was a privilege. And we talked about it at the end of the week or different times. I know this is hard, but we're really making a difference, and we're providing other people the opportunity, more importantly, to make a difference in their communities. So it was hard, but totally worthwhile.
I know that you have a couple more slides that are some examples of some of the things that were funded. Do you want to? Can you share a
Yeah, I
little
thought
bit
it'd just
about
be
that?
good maybe to provide a few examples specifically for Michigan and what happened there. So if you see, we had 16 providers in total who were awarded over $5 million and a range in size from $9,000 to $715,000, which is indicative of the program. We saw, of course, a lot of bigger health care providers, but also a number of smaller ones that really needed, less money, but they needed desperately. And so it was a success, of the program that we could fund this wide range of worthy applicants. So for the Henry Ford Health System, just some examples of what they were using for that $715,000 for, like we talked about, telehealth platforms, network upgrades, video conferencing software, laptop computers. We're talking about devices to safely monitor and treat COVID-19 patients and patients that do not have COVID-19 but need care to telehealth for other things. They also were able to offer behavioral health care and emotional support services to patients, which we saw a lot of, which was a big part of what a lot of these healthcare providers are providing out there today. At University of Michigan Hospital in Ann Arbor, they received a funding commitment of $649,000 to implement remote patient monitoring and to reduce the need for hospital admissions. And they expanded the video visit capacity so patients with and without COVID-19 can receive medical care at home. So, just moving the ball forward on how many people we can treat through telemedicine. And I think we're also seeing not only are the healthcare providers getting behind that, but the patients are now seeing the value more than ever. And then I think on the next slide, we have a couple other ones that just might be of interest. At the bottom there, we talk about there were some smaller awards at the Community Healing Center in Kalamazoo, $36,673 for devices to assist with substance abuse and mental health treatment. So they can use remote video sessions so people don't, have to come in, and we can reduce that contact. We also had Easter Seals. They had, they needed funding for a telehealth platform for face-to-face therapeutic services. So, there's a number of, those are just a few of the examples in Michigan of the 16 awardees who are doing great things with this money that Congress, provided in the CARES Act and really making a difference in Michigan.
Were there certain things that you and your team were looking at as you decided what was funded through this program?
Well, as I said earlier, the commission's order told us to review them on a rolling basis, but also look at hardest hit areas. So we took those into account, and that's how we got that. That's how we've approved the 539 applicants.
39, yeah. What's the feedback that you're getting? Are you hearing some good things from the field or from those that you have funded, or is it still too soon to really know?
We're definitely hearing some wonderful things, and had some really great emails, and it really means a lot to the staff when they're working hard and we get something for somebody on the front line and said, this made a difference. And so it's already making a difference in a lot of areas, but the true impact is yet to be measured. I think it's going to be really fun to see and interesting for us to study so we can all learn from it. How much of an impact did this have, and how can we understand that better? But we're hearing, like I said, the initial responses are emails and voicemail messages just saying, this is, thanks so much, it's making a difference. But as part of the process, we do funding commitments, and then after the funds are dispersed and purchased, then the healthcare providers come back and invoice. So we're in the invoicing process. That's ongoing now, and we're approving invoices as they come in and they're reviewed. So as that happens, we'll have more and more evidence of the impact of this program.
When we talked about preparing for this webinar and what kind of things that we should definitely touch on, one of the things that you said to me that really struck me, and I'm going to read it, is that this is the future, it's here, and it's emphasized by COVID-19. It just has turned up the timeline. So there was some planning that was happening beforehand with some rural healthcare programs that might have been just a bit underutilized, that type of thing. Can you talk a bit about the idea that there was already some thought process in this space? I mean, the FCC chairman himself, A.G. Pye, is very much about rural telehealth.
Absolutely.
Because his parents were doctors in rural Kansas. And So I know that there is a lot of talk through the FCC, and there has been over the last few years, but what has changed? Is it just COVID? Is it that what were you doing before? And I guess now and looking forward when it comes to rural healthcare and this timeline of telehealth?
Yeah, no, absolutely. So I think we have evidence, at least through looking at our rural healthcare program, that the trend, we were already trending towards the increased use of telehealth, and people were starting to grasp the importance and maybe also the business side of it, and how there could be a positive in many ways. And so as that has happened, and as we've seen our interest in our program grow. So just a quick overview of the FCC Rural Healthcare Program. Then I do want to get into those trends because I think they're interesting to your point. We have a rural healthcare program that's made up of two sub-programs, the Telecommunications Program and the Healthcare Connect Fund program. The telecommunication program subsidizes the difference between the urban and rural rates for telecommunications services purchased by healthcare providers. And the Healthcare Connect Fund provides a flat 65% discount for the cost of broadband services and facilities for eligible healthcare providers. You can see on that slide, there's a number of ways to be eligible for the program. Number 7, skilled nursing facilities, was added just a couple years ago. The rest of the list has been consistent for a while, but that was added by Congress a few years ago. So they're also eligible for the program. But the next slide, what you'll see is demand for our program has gone up significantly in the past few years. We've historically had a $400 million funding cap for our rural healthcare program. And when I came to the commission 6 years ago this month, it was viewed as, well, that's sort of a sleepy little program. It's important. We're going to do a great job with it, but it's not, we never come close to the cap. And then the trend started changing quickly. In funding year 2015, we hit $377 million, which we're under the cap there, but to us as a staff in WCB and in TAP-D, that was a sign like, okay, let's get ready because things are coming, and this is really important. And we, of course, reading the literature and learning what we all have been learning the last few years, it seemed like that made a lot of sense too. And then funding year 2016, for the first time, demand went over that $400 million cap. The commissioners were able to prorate the funding requests to ensure that everyone that was approved got funding, but they received about 96% of what they requested. So it was prorated to 96%. Funding year 2017, a big jump up to $521 million. Obviously, that exceeds the $400 million cap. The commissioners, once again, I think this is also a great example of a federal agency acting nimbly and reacting to what's going on out there in the real world, and not being stuck by the old rules. We were able to quickly increase the cap so that we could provide full funding for everyone that year. They increased the cap to $571 million and also ensured that it's adjusted for inflation every year like our other programs. And they also were able to utilize a mechanism to roll funds forward when things are committed but not invoiced. Then we have an opportunity to provide more funding for others. Then quickly, we could say funding year 2018, another big jump to $667 million. The commissioners once again found ways to fund the commitments and to make it work. And then funding year 2019, $719 million. So we've gone from $377 million, which was high at the time, thought of to be very high, to $719 million in just a few short years. And
nearly doubling what the original cap was.
Absolutely. And
this year,
a couple years before that, just a couple more years, and you're really like, it's crazy when you look at the jump.
Vested interest here, and our nonprofit really works with broadband related type things, and that's why we're interested in telehealth, because we want to help people get it. Talk a little bit about the discount for the broadcast services and facilities, what that means for HCF.
So that means if they're approved, if they have a funding request and it's approved, that we'll pay for 65% of that cost. If it's for the broadband, connectivity they need, if there's a number of things that are eligible, but there are any general broadband services they bring to us that are approved, funds 65% of that. And that brings some simplicity into the program. With the telecommunications program, it's a little more complex because we're looking at or much more complex. We're looking at urban and rural rates, and it's important to do it that way for the way that program functions. But this one, we found that having this flat 65% rate has worked really well for the Healthcare Connect program.
Yeah, in a lot of areas that have lost hospitals and those types of things, rural healthcare and telehealth can really be, not to be cliche, but a bit of a lifesaver in helping families get access to that healthcare they need. Are you finding that rural hospitals or rural telehealth programs are understanding the program and are accessing some of these things, or are there things that you want them to know that they don't quite understand, or that maybe you would encourage them to reach out to your team about?
Well, that's a great question. I think it's, as more people, I think, just me once again, part of the increase in demand is the program is people becoming more aware of this resource out there where they may not have been. And we give our administrator, USAC, the Universal Service Administrative Company, a lot of credit. They try to really make sure people know about the program, eligible healthcare providers. And when they're contacted, they work really hard to help them through the process so they can understand what they need to do and how to participate appropriately. And so there's been a lot of effort there. And of course, at the commission, we do the same thing. So there's been a lot of a push to get more people, make sure more people are aware, but also organizations like Connected Nation Michigan are really important. It's not done the same way anywhere. Every state's different. Yeah. But what I've found, maybe this takes me back to my days as working on the state level for many years, but when the state's involved, that's when the people in the communities that are really rural that are going to find out, get the information. That's when they're going to say, okay, I know you, you're a trusted face. I can do this. So I think, we can do a lot, but when we're in partnership with organizations at the state level, that's when you really have an impact. And I should say, to your point about, rural hospitals, being from West Virginia, my mother and my sister and my cousins and our niece and nephew family are all back in West Virginia. And we've seen rural hospitals closing at an alarming rate over the past 10 years. And it makes these services even more vital because now in order to get to a doctor, if they don't have some sort of access remotely, you're having to drive all the way to Charleston. You may have to drive 2 hours or drive, and it's just not economical and it's just not the way it should work. So this another reason why this is so important. And I've seen it firsthand with my family.
We just had a question from someone who was wanting to make sure that we'd share these slides. So I'll make sure that when we publish this webinar, which we will be putting it out there so other people can see it in case they couldn't get here for their schedules, I'll make sure and share your slides as well, Ryan, Great. When we do that. So let's, we've touched a little bit on the healthcare programs and rural healthcare. What are some of the reforms that you're implementing moving forward? Some of the challenges that you're seeing, those kinds of things. What works, what really doesn't work? Maybe I think we need to do A, B, and C, but really D, E, and F work better. What are some of the things that you're seeing moving forward?
Well, I'll say with our rural healthcare program specifically, we've just completed, we've completed the FCC portion, the order. We adopted an order reforming the program, but I always have to pause. That's when the reforms really start because now we're working to implement them along with our administrator and the parties who participate in the program. So, but in August of 2019, the commissioners adopted an order enacting significant reforms to the rural healthcare program and changing the way some of our mechanisms work. The distribution of rural healthcare program funding was adjusted to try to be more efficient and to encourage or to adopt rules that discourage waste, fraud, and abuse. But more appropriately, we're targeting funding the rural areas that were in most need of healthcare services to ensure that eligible rural healthcare providers continue to benefit from the program. And it was prioritizing support based on rurality and whether the area is medically underserved. So in the future, if we hit the cap again, and there isn't sufficient funding to roll over or to provide a way to fully fund the request, the commission now has a prioritization mechanism in place. So we know that the rural areas and the medically underserved areas would be the first to be funded. And there's more nuance to it, but that was a big step because the way we're growing. And it takes the commissioners to, an act of the commissioners to increase the cap. This way at least provides some certainty for those healthcare providers, and they can know how that would go.
So is the current cap at that 700 million, the last?
No, the current cap is, I don't have the number right in front of me, but I believe it's around 607 million because it's increased for inflation. So that number, even though the way they fund the full 719 is to also, we talked about there's some funds they could roll over from previous years, things that weren't invoiced, and make some other adjustments to fully fund that. But the cap is well below that. And
so, so now your team will take this new order, and which new it's late 2019, and try to place that and work with rural communities using these parameters. Is that correct?
Correct. And one of the changes that we're implementing was a change to the way the rates are determined, the urban and rural rates are determined for the telecommunications program. Mm-hmm. And that's been, so it's something that's very important for the participants in that program. So we're doing that, but in addition, we're, continuing to implement the other reforms as well.
It occurs to me that I have not asked you an important question. Where does a lot of this funding come from? You mentioned E-rate, and it triggered that in me that I should have asked you. Where are these funds coming from?
Yeah, so for all of our programs, and it's one thing I have to emphasize, it's a limited pool of money where Congress gave us, told us to go, pursue universal service, but they also said we have to balance the burden on ratepayers. And so everyone, the carriers who provide telecommunications services pay a percentage of their revenues and that's called the contribution factor. It's calculated how much is needed, and there's a factor that they apply to fund these programs. So it's assessed on a quarterly basis, and our administrator looks forward to the amount of money it will need for the programs for the next quarter, and then assesses the contribution factor on those revenues from our regulated companies.
I heard the dog.
Yeah, there's my...
You made it far, but I heard the dog that time. So just looking ahead, I know none of us have a crystal ball, but from your point of view, maybe you could share some we've got a question we'll check into right now too, how things are evolving, that type of thing. Let's see, we do have one question from John. Ryan, thanks for this excellent presentation. You said that the demand for the COVID-19 Telehealth Program greatly exceeded the 200 million you were given by Congress. Can you say more about how large the demand was? The rumor is that you received requests for 5 times that 200 million. Is that accurate, or is that just rumor? What do you see?
Thanks, John. Thanks, John, for your question. It definitely greatly exceeded the 200 million. I'm not aware I don't believe the commission has quantified that number other than to say significantly exceeded the cap. So I have to, be smart about what I say, but definitely we've been very clear, and the chairman as well, I believe during some of the hearings recently has said it far exceeded the cap. But I'll double check, and if there's a number that we have put out there, if I find it, I'll send it to you, Jessica, and you could include that.
Yeah, I'll include any extra info you give me. Well, then let's just stick on that question for just a little bit. Do you think that the demand is just going to be exponential now because of the time that we're in? Are you seeing trends of that where there's so much demand that this is just going to continue to grow and grow?
Well, I'm not an economist, but what I will say is, something we touched on earlier is, this really moved the timeline forward, in my opinion, for telehealth in a lot of areas in our country, maybe across the whole country and maybe across the world. I don't know, but what was coming, what we already saw with our trends in the rural healthcare program and the increase in demand. So we saw it was already starting. Now it's just, totally taken it to another level. And I think that speaking to participants in the COVID-19 Telehealth Program and saw all these wonderful facilities out there that are really making a difference. we've heard, like, wow, this is great. We're aware now. We're more interested. We're going to be pushing telehealth. Like like a lot of them were like, we knew this is important, but we just couldn't quite get to it, or and this pushed us over the edge, and now we're all in. So I think we're hearing anecdotally, but I think accurately from a lot of healthcare providers that this was sort of the push they needed. They've been planning for it, thinking about it, and dipping their toe in the water, but now they're all the way in because speaking for me, it's hard to go back once you're all the way in, and you how much this can impact your patients and the people in your community.
Well, as we said at the top of this webinar, this is the 4th of 5, and we have had some providers on, and they have talked about, one said that they moved a 5-year plan up to 1 year, and kind of like what your staff had to do, where you're suddenly slammed and having to make decisions. Another provider told us that really what helped with some of that was the lifting of some regulation around telehealth. Can you speak to that at all?
I really can't. I mean, I know that we're always looking at ways with our USF programs to minimize regulatory burden on our applicants and participants in our program. So at the FCC, part of those reforms in 2019 we're focused on, always looking at ways we can make, like I say, be more efficient and reduce the burden on our applicants. But I believe those references are to things outside of the FCC. So I'm not had time to dive in on those too much.
Gotcha. I know that a lot of this is emerging, which is why we wanted to talk to you about it. We do have a question. The question is from the audience, and please, everyone, send in your questions. We want to know what you really want to know, so that we could put Ryan on the spot here. I'm kidding, of course. First off, is there any active consideration of expanding the Universal Service Fund, e.g. by expanding the range of entities and services that contribute to the fund?
That is a wonderful question, and one that we get, one I've heard a lot of. So there's an open proceeding with the state federal joint board to look at contributions reform, which is what that would take. But there hasn't been a significant amount of movement on that for a while. I do know that some of these questions come up every so often when there's hearings with the commissioners on the Hill, and there's people have different ways of looking at it. There could be a number of different approaches. It's something that people talk about, but I'm not aware of any specific any news on that right now. So
just in your role, Ryan, do you I know the commissioners are the ultimate decision makers, and then it goes down the line. But what is your interaction with the commissioners? Do you make recommendations, or is it that you implement their programs and it goes that way, or is it both ways?
It's a combination. That's a great question. So any big decisions, issues of first impression, or approving spending money or reforming our rules or anything like that. Of course, that goes through the commissioners, and it requires the commissioners to vote. And in those situations, our division works up recommendations and understands the issues, and of course looks at all the pleadings or all the different filings that have been made, and depending on if it's a complete rulemaking or a one-off situation, and work our recommendations up to the commissioners, and of course hear from them what they would like and what they need, and we adjust accordingly. Also, oftentimes in commission orders, or sometimes they delegate to the Bureau to make certain decisions that are, as far as running the program. So when we have delegated authority, we often handle those things at the Bureau level. But of course, those things can always be appealed to the commissioners.
Okay, we still have a couple more questions here. This is great. I love seeing the audience get involved. I might help you with this one. It's from Mark Miller. He says he lives in an area of about 27,000 residents where elected officials aren't really interested, which, I mean, that can happen. People may not see the need or importance of broadband or telehealth. He says, in addition, some employees have actually worked against broadband. What suggestions do you have? Mark, if you would like to expand upon that, you can, but I'm gonna what suggestions do you have do you mean as in, I think maybe approach it, Ryan, with what are some suggestions you have in bringing this good information to his local officials?
Yeah, I mean, it's tough. I know in my experience on the state level, there were definitely people and mayors and others who didn't see things that the importance of rural, broadband access the same way I did. And I think continuing to educate people, it's hard. It's often a slow process. But we do, have a lot of great information out there and great programs, but I think it starts, they really have to get it, whether it's maybe the state leadership that needs to come in and take a more active role when the local, if a local community isn't able to get things moving. But it is tough. Local issues make access difficult sometimes, and I've seen that firsthand in West Virginia back when I was working for the state.
Yeah, and if I may expand upon what you said there, Ryan, and to answer your question, Mark, I would say that in the last few years, as being the communications director with Connected Nation, I had to often explain why broadband would be important, whether it was for telehealth or remote learning or telework or just, social interaction or getting goods and services that were at a better price. A lot of people didn't understand that. If there can be any silver lining to a pandemic, there is a better understanding of how important this is, which I think is indicative, and maybe I'm over speaking, stop me if I am, Ryan, of the fact that there is being so much funding put towards telehealth. There is an understanding at the base level that this is no longer necessarily a privilege or a luxury, but something that we all need access to. And so I think that if you went back to a lot of these people that maybe were naysayers, you might find there's a different conversation happening now than there was 5-6 months ago.
That's a great point. And so I have a specific meeting in my head where I remember meeting with this mayor who said, why do I care? People in my community don't care about Netflix. And my point was, it's about so much more. And so that point, you're only going to realize that when it really has an impact on your life. And maybe now a lot of the constituents who will drive a lot of the agenda for these local governments are understanding how important it is to have access to broadband. And it is a lifeline in many ways.
It is a lifeline in many ways. And we're really seeing examples of that. And myself and staff with Connected Nation are working, some of us 12-hour days, just trying to keep up because of the need. And I appreciate that you're doing so much with telehealth, because I hear a lot from people, senior citizens and parents and all kinds of people that really need it. So some more questions. We've got a couple more from our attendees. A lot of RHC applicants have been a little frustrated by the delays in processing their applications. Several applicants have yet to hear from USAC about their applications in 2019, filed about 15 months ago. Are you aware of these delays? Is the FCC working with USAC to expedite and process applications going forward?
Yeah, we are well aware of the current status, and we are always working with USAC to try to do anything we can do to help provide them guidance, or just so they can process things faster. I know they're working at it. I know they're working very hard, and we've definitely heard about this, and it's something we take very seriously.
Yeah, that's not really that's a tough question, I can imagine. And has just to piggyback on that a little bit, has suddenly this huge influx of work caused some of that, or is that just something that's just taking time to process?
I think I'm sure there's a number of factors, but like I said before, we do pride ourselves in our ability to be nimble and adjust to things. It does take time. It doesn't happen with the snap of a finger. So we should be able to do that. And when I include USAC as part of we here. We are, we do everything together when it comes to administering these programs, and they do a wonderful job and work really hard. But when we hear about, delays and things, we take it seriously just like they do, and we're trying to work through these issues.
We've got an interesting question. I had not thought about this. This comes from Lynn Nelson. Telehealth could extend all the way to persons' homes. When they call 911 and EMS arrives, there are significant challenges throughout rural America in accessing the internet via a variety of systems. The infrastructure is lacking. We hear of programs such as FirstNet and others. The FirstNet, we've done some work with them in Iowa, but that hasn't distilled right down to the boots on the ground operations. Are there telehealth initiatives sensitive to the lack of infrastructure and delving into making progress in that area?
I don't know that I would say I'm not aware. I mean, of a telehealth initiative solely focused or primarily focused on building infrastructure where it does not exist.
Mm-hmm.
But what I will say is our high cost programs are focused on, on allowing these businesses to go out and build infrastructure where needed to provide broadband to people throughout rural America, to provide access to people and communities that really need it, like we're talking about here. And we have our Rural Digital Opportunity Fund auction, which we're working on now, and we have a number of exciting initiatives. They are steps in the right direction. They won't provide answers for every community, but they will be a big step forward. And so that's our approach to it, to trying to fill that gap. But it's not a telehealth specific initiative. It's more the general infrastructure.
Yeah. Also, just to piggyback on that one as well, there are several programs that are focused on rural areas right now that are adding funding for infrastructure, specifically the Reconnect program through the USDA, which is separate, but you guys are all, I mean, it's all in Washington, but you work separately, I know.
Yeah, they're just up the street. We see them all the time, or at least we.
Yeah. Well, there you go. But I know they are doing a lot of funding that's specific for infrastructure. And as you mentioned, the RDOF fund, that type of thing is very, very, there is a big emphasis across the country right now on funding infrastructure for broadband, i.e. high-speed internet, which can then be used for telehealth and all these different services. That has happened even in the year and a half, especially leading into 2020. So even before all of this began happening, that was an emphasis that was happening in Congress and with the FCC in different departments. Would you want to expand upon that, Ryan, or did I get that right?
No, I mean, I think you're right. Once again, this hits on our point that we keep coming back to. Like, things were already trending significantly in this direction, and now the point is clear. And I'm not in the business of ever predicting what Congress is going to do, but I think it would be a pretty easy case to go up there to the next Congress and say, or maybe now, and say, here are a number of initiatives. Like, we've seen you've spent your money wisely, Congress. Here's the evidence when you've committed funds to help connect, to help support telehealth. So let's keep this going, because it's really having an impact on our rural communities that need it so much.
Where would you, I mean, I know that the commissioners really, you work with the commissioners to drive where the program will go. What would you, in your best case scenario, where would the division that you lead end up when it comes to telehealth? Where would you like to see it?
Well, I think the first thing I want to see is continue to do better when it comes, running the program and becoming, extremely efficient with ourselves and USAC running the program as we have it now. And we are just at the beginning of implementing these significant reforms, which we think are going to make for a much better program. So that's what I'm focused on now. Long term, I have to leave that up to the commissioners on if more money makes sense. Maybe it doesn't, or if different approaches or something they would like to do. We're all always available to discuss and offer recommendations, and our staff, we have a lot of thought about that. But I will say we are focused on implementing these reforms and doing everything we can to keep the program running efficiently now and to make it better.
All right. I think I've wrapped up most of my questions. I just want to kind of give you a chance to emphasize some things that we talked about before in preparing for this. Some things you'd said is that we know this is a necessary part of healthcare in the future even, and that it can save money and it's important and it's useful for patients and healthcare providers. Do you want to talk a little bit about why telehealth is really going to continue to have a prominent role before we wrap?
Sure. I mean, I think that what we're hearing anecdotally, once again, from a lot of these healthcare providers are, this pushed us over, really made us focus on it, but we're already telling once we get this up and running, make the initial investment, it's not only going to provide better access and care for our patients, but it's also going to potentially be a good business move for us. And they're seeing a lot of promise there, which is exciting. Once again, it's not my area of expertise, but I love hearing about that from our healthcare providers. But I can just think of my family. My dad lives in Cheektowaga, New York, and he needs, he's needs a lot of doctor visits and things. And oftentimes in the winter, he can be snowed in for weeks at a time. And last year last time that happened, he really had a lot of visits he needed to do, and he was able to connect with his doctor. It made a big difference. And that sort of changed his view on it, because he was anti telehealth at the time. He wanted to go in and see his doctor. And then my mom now, she's in rural West Virginia, and she, I don't want her unnecessarily going out and mingling with people if she doesn't have to, even if it isn't a safe place. And her doctor's office has allowed her to do telehealth checkups, and she's been doing that, and they can monitor her diabetes and things. So it's just been wonderful to see the impact it's had on my family specifically, and my parents. And I think everyone out there has an experience like that now. I would bet almost every family is changed the way they view because of our experiences now. And there's, I'm not one to look for silver linings in horrible situations, but if we have to find one here, I think this could be it. Like with COVID-19, the realization that this is the future, that this can be better for everybody, in many different, from many different angles, I think is just exciting to see people's eyes opening up. Just like it's exciting to see those people are still not all on board with the need for broadband access throughout the country. Like we talked about how that's starting to change too. Like these experiences are impacting their life and changing their perspective on what's necessary. And it's fun, or it's interesting for me to see, as someone who pays close attention to this space and has for a long time. It's interesting to see the progress. It's really ramping up.
Well, that's well said. And I want to agree with what you said. Being in the broadband space is definitely somewhat of a relief to be able to see that people are beginning to understand why it matters. And I want to thank you for joining us today, for sharing your expertise and your insights. I know you're extremely busy and your staff is extremely busy, so thank you for that. And thank you for all you're doing in the telehealth space.
Yeah, it was my pleasure, and I appreciate the questions. It's always a lot more fun when we have questions.
Yeah, it is a lot more fun. So Ryan Palmer is the chief of the Telecommunications Access Policy Division, or TAPD, within the Wireline Competition Bureau of the FCC. We really appreciate joining us today. We have one more webinar series as part of this 5. Connected Nation Michigan will continue it on Tuesday, October 27th. During that webinar, we will focus on the questions you still have about telemedicine. What are some of the things that we have yet to address in these webinars that you want to know, or that you just want more clarity on for your understanding? We'll have a panel of experts to provide insight, guidance, and answers. We invite you to send your questions in advance to info@connectednation.org. That's info, I-N-F-O, at connected, that's connect with an ED, nation.org, or just join us for the October 27th webinar and send them as you have them. Also, we will have registration information up for that webinar in the next few days on the webpage listed on your screen. Again, you could just send us an email and I'll make sure you get the registration information. Thank you for joining us. Thank you, Ryan, for joining us, and we hope to see you at the October webinar.
Thanks for having me.